As the temperature increases, so does the risk of tick bites, which, as we know, can be a host of various infections, one of which being babesiosis. Joining us with more on this is Dr. J.P. Saleeby, Medical Director for Carolina Holistic Medicine. Dr. Saleeby, thank you for joining us today. And I want to ask, how does this differ from other tick-borne illnesses?
So most of the times people get infected by a tick bite, and the tick can give you multiple things. One is an organism that likes to live inside cells, like red blood cells, called Babesia. And there are a couple of types of those species that predominate in the United States. And they are very difficult sometimes to identify.
Okay, why is that?
It's just the tests that we have. Some of the PCR tests and some of the fish tests that we use don't pick it up. But the traditional way is you get a drop of blood on a microscope and you smear it, and then you look under the microscope for these intracellular organisms. And I think we have a picture of one, a red cell with that being identified. The thing is, they're very elusive. But when it gets bad, it can be very dangerous. It can actually kill people because it lyses cells, and they can be very, very anemic and die. So oftentimes people get multiple transfusions. And we're trying to figure out, the doctors are trying to figure out why these people are so anemic. It's not iron deficiency, it's not a B complex problem, it's cell lysis. And if they're not careful, they can overlook it, and then that patient goes undiagnosed.
And now you mentioned that when someone gets bit by a tick, it can, the tick is could be a host of a bunch of different issues, and co-infection can happen. What is the relation to Lyme disease? You joined us last week and we spoke about that. What is that relationship between the two?
So probably Babesia and or Bartonella. Bartonella is another type of organism. And most people might know that as cat scratch disease, Bartonella. But Babesia might be the most common co-infection that a tick will give you. And some in my circles think that it might even be more common than Borrelia, which is the causative agent for Lyme disease.
And so co-infection, is it common?
Oh, very common.
Really?
Yeah. Just this week I had a fellow who had 6 co-infections.
Oh my goodness. Yeah. And now when you're looking at someone with 6 co-infections, how do you go about treating that?
Well, that's a great question, and it's highly debated right now. Some people think you have to go after Babesia first and then Lyme. Some will try doing them together or other way around. I like to just treat all that I identify. I think it's important to kind of treat all at the same time, because I don't think your patient's going to get better if you focus on one and not the others.
Yeah. Are there any, future potential for an umbrella treatment, one treatment that can, cure all of these tick-borne illnesses at once?
Yeah. So they're looking at particular agents. There are some newer emerging ones and repurposed ones. Those are the best because we know they have a history, have safety and efficacy. And if we can reuse a drug, a repurposed drug, that might be safer. Tefenoquine or Aracota is one that is coming to prominence. It might be more effective than some of the other antiparasitics, but traditionally it's paired up with something called Mepron and azithromycin. So you need 2 types of antimicrobials to treat babesiosis effectively, especially in later stages.
Okay, so early treatment is key.
Very key.
And now what are the symptoms that someone should be looking out for?
Big one is fatigue. Air hunger. People they just can't get enough air in their lungs. It's not a yawn, it's just they keep air hunger, that profuse sweating, daytime, nighttime sweating, and fatigue. And anemia. You can pick that up on blood work, where their red cells are very low and they might need transfusions. Yeah.
Okay, so what are the long-term potential side effects if you don't get early treatment and you get later treatment?
Sure. So chronic infection can cause extreme fatigue and can cause disability. People might not be able to work, might not be able to get out of bed. And then, of course, if the cell lysis is tremendous, then they could have life-threatening anemia.
And now where do we see this most prominently, this infection?
It's all over.
Really?
Yeah, the Northeast maybe more so. Where I did my Lyme training, Babesia was a very common, close second infection to Lyme.
And now where can our viewers go to learn more?
CarolinaHolisticMedicine.com. We are, me and my providers are all Lyme literate, so we're used to treating all kinds of complicated Lyme cases.
Wonderful. Dr. Saleeby, thank you so much.
All right.
We're back after this.